Advanced prostate cancer is built on teamwork. You need people who have areas of focus. And here at Mayo Clinic, we've got physicians and experts who have these areas of focus. But every team needs a captain. And what's clear at Mayo Clinic is the captain of that team is the patient.
Working together as a team has always been one of the true landmarks of Mayo Clinic and one of the things that we do so well here. I would say a lot of our advanced prostate cancer patients really will be seeing their care involving a medical oncologist and a radiation oncologist. I work really closely with my colleagues in diagnostic radiology and nuclear medicine who provide us with wonderful CT scans, MRIs, and PET scans, which allow us to diagnose and determine the extent of disease in the patients with advanced prostate cancer. It's that collaborative approach of first seeing where the cancer is and determining if and how we in radiation oncology can target our treatments towards that cancer.
You know, it's important for patients to hear that they have an army behind them. They're pharmacists behind the scenes to double check the doses of the medications, make sure there are no drug interactions. We have nurses that patients are talking to through the portal and by phone to check up on patients with side effects or other concerns.
One of the things I always love about working at Mayo Clinic is everybody always seems to find a way to say yes, even if it's not an easy yes. I know I can pick up the phone and talk to somebody within minutes and try to come up with a plan for a patient who may have a very complex situation and need the input of multiple other specialists beyond what I can provide.
Communication is essential. You need your physicians talking to each other, and you need your physicians and providers talking to you as the patient. Something that we emphasize is we don't want anyone to feel lost in their cancer journey. When you get a diagnosis like this, it's overwhelming.
All the patients get here through a different pathway, and they all have a slightly different journey. It's important to have me there along the whole way, along with my colleagues, so they feel that continuity of care and that there's some consistency and familiarity with their story.
I think that's what makes Mayo Clinic special. That collaboration leads to more precise diagnoses, more treatment options, and better care. We're not just focused on survival, but we're focused on living a good quality of life for a long time.